Hello everybody. Today let's learn about hookworm infection. Hookworm infection is one of the most common parasitic infestations in developing countries. And as you can see from these pictures, hookworm infections can cause weakness and easy fatigability. Let's see why. Hookworm is a soil transmitted helminth. Two species are mainly responsible for human infections: Ancylostoma duodenale and Necator americanus. In soil, the hookworm eggs hatch and the first stage larvae, called rhabditiform larvae L1, develop. They molt twice to become the infective filariform L3 larvae. The L3 accumulate in soil or on grass awaiting exposure to human skin. The infection starts when the larvae penetrate the victim's skin, usually by walking barefoot in damp soil. Penetration takes place with the help of various hydrolytic enzymes that facilitate parasite entry and invasion. Cutaneous penetration sometimes might cause what is called ground itch. Ground itch is due to some allergic protein produced by the hookworms. Following penetration, the L3 larvae enter into the small subcutaneous venules and through the venous circulation reach to the right side of the heart and finally to the lungs. During the pulmonary stage, the infection might express itself in the form of cough, sneezing, bronchitis, hemoptysis, and eosinophilic pneumonia, also called as Loeffler syndrome. In the lungs, they enter into the alveolar space and migrate up to the bronchi, trachea, and finally by swallowing of sputum, they enter the GIT. Once worms reach the small intestine, non-specific abdominal symptoms might occur, such as abdominal pain and distension, diarrhea, occult fecal blood, and occasionally melena. Once the larvae reach the duodenum, and after molting twice, they become L5 immature worms that can use their teeth or cutting plates to get fixed into the host intestinal mucosa. The major feature of hookworm infection is iron deficiency anemia secondary to blood loss. Blood is consumed by the worm and also oozes out from the site in response to an anticoagulant made by the worm. Simultaneously, protein loss might also occur and results in hypoalbuminemia, which might lead to edema formation and generalized anasarca. The worms mature in 4 to 6 weeks. A gravid female of Ancylostoma duodenale can lay 10,000 to 25,000 eggs per day, whereas that of Necator americanus can lay 5,000 to 10,000 eggs per day. Unembryonated eggs are released in feces, and the first stage rhabditiform larvae hatch out from these eggs, which then molt twice and finally become the infective stage, that is L3, and the life cycle continues. Now let's review what we have learned with a question. A child is brought to you by a mother. The child appears emaciated and upon testing is found to have hemoglobin level 5 gram per deciliter. Her feet and ankles were swollen and there is extensive rash on her feet, ankles and knees. The most likely parasitic infection that causes the child's condition is? Obviously, this is due to hookworm infection. Blood loss causes anemia, protein loss causes edema, and by the rash they are referring to ground itch. Hope you have understood the life cycle and the clinical manifestation.